Thank you, and good evening. I'm Dr. Victor Dzau, the President of the National Academy of Medicine, and I'm here to welcome all of you to the launch of our Global Healthy Longevity Grand Challenge. This one is the roadmap, which is an important component of our Grand Challenge. And I'm going to show a few slides just to explain to you what this is, although some of you might have seen this already in other circumstances, including this morning, but I'll make it brief. I think what we're here to discuss is this important. Can you advance the slide? No. I can do this without slides. Maybe it's even better. What we're here to talk about is this really important global issue of more of an aging society, if you will. We all know that statistics that is looking at where we are today, and it is projected by 2050 the number of people over 65 will double globally, and the number of people over 80 will triple, making about 20% of the population globally over 65, mounting to close to 2 billion individuals. This I see as a great opportunity, but some people see this as a great challenge. Because if you consider simultaneously a drop in fertility rate, the number of people less than age 5 is already about the same as those over 65, and soon, within a year or two, the number of people over 65 will surpass the younger population. So the question is, why are we doing this today? Well, as someone would say, you're facing a silver tsunami. That is, it's a fundamental issue of concern about burden of disease, chronic disease, stress in the health system, and economic impact on the whole country or globally, issues as social and other infrastructure, family structure, etc. But we all see this as an opportunity as well, because we do know this cohort of people can be extremely productive and want to contribute to society. Perhaps more importantly, as you look at the whole biology of this process of aging, and what we call longevity, as you live longer, that in fact there are many touch points in one's life course that can make a great difference to improve health of this population. So when we thought at the National Academy, what is a grand challenge, we've identified that this global aging, or better still, healthy longevity is our grand challenge. What we hope to do is to be able to bring together two major components. One is looking at roadmap of how to achieve healthy longevity. How do we do that? We do it through a commission that you will meet today, the co-chairs, that is Linda Fried and John Wong. Linda Fried from the United States, John Wong from Singapore, that will bring together, as they tell you, a commission that is looking at three major areas: the social, behavioral, and environmental enablers, the healthcare system and public health, and the third is innovation and science. And of course, these commissions will look at each one of these issues, but at the same time will consider all cross-cutting themes that include policy and practice, health equity and disparities, innovation, financing, and monitoring and metrics. And what you see here today, we had all day, is the workshop on the first work stream on social, behavioral, and environment enablers. But we're here to launch this whole roadmap. And the idea is that these three work streams will report up to the Commission, and the Commission over 18 months will generate report that look at specific recommendations globally, learning from all our colleagues from all different parts of the world. And this commission consists of people from 8 different countries, 6 different continents, so we get the best minds. And hopefully we'll go forward with a set of recommendations that would enable different governments and decision makers to enact what's right to enable, first, the older population to be more functional, mobile, healthy, and active, but also to look at the life course issue, that is, to have intervention that can influence how one ages. our whole idea is to enable better physical, mental, and social well-being as people age. So that's the purpose of this. So I'm here to launch this initiative, and we're really, really pleased to have to do this at the AARP, and of course, our close collaborator, our sponsor, AARP, and of course, Deb Whitman, who's the Director of Public Policy at AARP. And I guess you'll come up and say a few words. Thank you.
Good evening, everyone. Thanks for that. I want to welcome you all here to AARP. I'm here on behalf of our CEO, Joanne Jenkins, who is serving as the Vice Chair of the Global Roadmap's International Oversight Board. Unfortunately, Joanne couldn't be with us here tonight, but earlier today, she gave us an important challenge. She challenged us to be disruptive in our solutions and to find real ideas that can help real people across the globe. The rise in life expectancy across the globe has been dramatic. By the middle of this century, adults aged 60 and over will represent 22% of the world's population. That's double than their share today. And because of increased longevity, we have opportunities for continued productivity and growth that our parents' generation never had. But simply living longer is not enough. It's about being healthy longer, which is why we need to not only pay attention to lifespan, but also health span. Yet when we talk about healthy longevity, it's important to understand that neither health or longevity is equally distributed. Education, income, race, and gender all really matter. And the big winners in the lifespan lottery are the affluent and the educated who have the greatest chance of experiencing healthy longevity. It's a sad prospect that the most important factor of how long you may live in the U.S. may be your zip code. For example, as we heard from Ali earlier today, people who live in Summit County, Colorado, have a life expectancy of 20 years longer than those less than 500 miles away in Olalanga, Lakota County, home to the Pine Ridge Native American Reservation in South Dakota. That's 20 years more to be with your family. It's 20 years more to give back to society. Too often, we talk about inequality of income and wealth, and we miss the fact of the huge inequalities in time that people have across the country. Across the globe, we see that countries with the highest average life expectancy also have the lowest levels of disparity. So to improve health span, we need to develop clear priorities and directions for promoting health, productivity, and quality of life for older adults worldwide. And that's why the topic of today, social determinants of health, is such a key one to get right. We must change our education systems, our workplaces, our health systems, our communities, and even our traditions, which are not set up to support a society that is living longer. To this end, I'm really proud that AARP is taking a leadership role on so many of the issues of improving healthy longevity. Today, as we launch this important global roadmap initiative, I want to encourage those of you who are on the Commission and who will be writing the consensus report to consider this. First, while the roadmap needs to provide us with a strategy for breaking down barriers and addressing the challenges of healthy longevity, it must also empower societies around the world to embrace the opportunities of aging to the fullest extent possible. Second, the roadmap must provide concrete recommendations to help all people reach their potential health span. To quote the United Nations, we must leave no one behind. And those of you that heard Janine's opening calling for equity disruption, I think we are in safe hands with this commission. But before I turn back to Victor, I really want to thank my team here at AARP who contributed so much to this week's workshop. In particular, I want to thank Erwin Ton. Where is Erwin? Erwin's really been on the lead of this relationship, helping to form not only our wonderful partnership with the National Academy of Medicine, but helping to set out the agenda, and has been a great advisor to me. I also want to thank Camille Wilson for her leadership, because Disrupt Aging has supported AARP's involvement with the roadmap from the very beginning. And thanks as well to Jean Axios, Ashley Johnson, Meredith Hunter, Kim Sedmak, Marissa Malta, Michael Epstein, and Alcida Golston for their support. Yeah, that's a long list, but it does take a village, and you'll thank them all in just a little bit when you have your drink in your hand. So this past weekend, Victor and I spent in Dubai with the World Economic Forum's Council on the Global Future Council on Longevity. So he and I have spent a long time together. We're both, as you can hear from my voice, a little bit exhausted. But I really want to thank him for his leadership in pushing the idea of healthy longevity, not just at the National Academy, but really as an important issue across the globe. So with that, I turn it back to you, Victor.
Thank you, Deb. She's been a great partner. She and I co-chaired this council, and we managed to get everybody in the same room, go in the same direction, which is healthy longevity. And so thank you very much. And the AARP has been more generous with your support, and really, it's greatly appreciated. Thank you. So this is now the highlight of this launch, which is getting a panel of distinguished individuals to have a conversation. And of course, it's my great honor to ask the moderator, to introduce the moderator, who in fact is our Assistant Secretary for Aging and the Administrator of the Administration of Community Living. So Lance Robertson is the Assistant Secretary of Aging who crosses two agencies, ACL and HHS, and therefore his remit is very broad. And it's really wonderful to us that we have a pivotal person in this country that looks at the aging issue. Many people tell me, look at Singapore. They have an interministerial initiative on aging, and they've got the pivotal leadership in it. We're so glad that, Lance, you're doing this for us. Because when you look at aging, you focus on 5 pillars: supporting family and caregivers, protecting rights and preventing abuse, connecting people to resources, expanding employment opportunities, and strengthening the aging and disability networks. So we're so glad you're here. Len's been also a great friend and supporter. Ever since we discovered each other, I guess we've been on multiple places together, including the launch of the global competition 2 weeks ago. So thank you. And joining Lens would be our co-chairs of the roadmap. That is Dr. Linda Fried, who's the Dean of Columbia's Melbourne School of Public Health. I don't need to say a lot more about Linda. Everybody knows what she's done as a great leader in epidemiology, public health, but particularly interested in aging and geriatric medicine. And so she's done so much. I would say that we did miss you at the council, but we're glad you're here. And the other co-chair, good friend, Dr. John Wong from Singapore. I've known John for a while now. We've been working on a number of projects in Singapore. But I think John is a well-known leader in academic medicine. He's the chief executive of the National University of Singapore Health System. As many of you know, I have a great affiliation to Duke, and we were kind of competitors in Singapore, and we're also great collaborators. And John is an oncologist and trained at New York Hospital and Sloan Kettering, and he's done so much in the leadership in Singapore, particularly now in the area of aging. So if I may ask all of you to come up here, and Lance, if I can turn it over to you. Absolutely. Thank you.
All right, test, test. Good evening, everyone. It's good to be with all of you, and how exciting to be here to see the launch of this roadmap. And again, I want to thank AARP as well for hosting this great event. Deb, what a great facility. And if you haven't really said congratulations to Victor, I hope you will with drink in hand. Lots of people to congratulate, but certainly want to thank Victor because his leadership has just been phenomenal. So I cannot thank you enough for the work and energy that you put into this, and congratulations. I think we're all excited about the launching of this important initiative and the global roadmap. Really, I also am excited, like you will be, to hear from both Linda and John. We have a couple of prepared questions for them, and anxious to kind of jump into that. Before we do, though, I just want to, as a quick remark, given that it's my honor to represent really our primary federal agency partner in this conversation, that really the launching of this roadmap could not be more timely. And really, globally, if you think about three big things that are happening, those would be three great examples for why now is the time. First, with the World Health Organization's declaration, as we all know, of the Decade of Healthy Aging, which is coming up May of 2020 at the World Health Assembly. That's one reason. Secondly, the recognition by the G20 leaders recently about the importance of promoting healthy aging, and that's exciting too. Our Deputy Secretary represented our Secretary at that particular function. And then finally, as we close in on the Healthy People 2020 initiative and embark on Healthy People 2030, which is housed, of course, in the Department of Health and Human Services. Again, the timing of this conversation is excellent because it feeds into all of that. So, again, just so grateful. My heart is full knowing that now is the best time to be having this conversation, to have champions like Victor and NAM, and then certainly AARP. So let's now then jump in, because we don't have a lot of time, but we do have several questions that we thought, a couple of questions, I'm sorry, that we thought we would ask, again, both Linda and John. So I'm going to just throw it out there if you two are ready, and I'll ask the question, and then you can each take it in order. Again, this is a very distinguished panel. I would encourage you, their bios are in the information, so you can take a good look at that for both Linda and John. So the first question: from your experience working on aging and health systems, so Linda, I know your experience is certainly square in the box of aging, John, yours in health systems, why do you think this is the right time to pursue such an ambitious initiative on longevity? And you can't repeat what I said about the three key reasons. I already took that, so you got to have other, yeah. So what, again, for both of you, why do you think this is the right time to pursue such an ambitious initiative?
This is why we're a good team. We defer to each other. Okay. Well, good evening, and thank you so much for moderating this, but really leading and supporting at the same time. And thank you to NAM and AARP. I think that your vision about the timing is as important as the vision about the goals. And so since I can't cite the ones you already did, Lance, I think there are a number of other reasons why the timing is meticulously right. One is, of course, that we have a situation where most countries of the world have seen substantial increases in life expectancy to this point, which makes how we transition to worlds of longer lives relevant almost everywhere in the world. And yet, we are also clear that the past may not predict the future we need. And we're at a juncture at this moment in time where we actually, to a good degree, have, through societal investments over the last 50 and 100 years, experienced the opportunity for longer lives. But we are right at the crux of decision making about what we believe in for the future with longer lives. And so this moment of timing is absolutely critical. Do we know where to go, or are we driving with a rearview mirror?
Well, I'd like to join Linda by thanking Lance and Victor and the AARP for hosting this launch and this initiative. I think I would just like to ask the audience whether they remember what they were doing on that tragic day, on September the 11th, 2001. I mean, I know exactly what I was doing. That was 18 years ago. And I dare say that in less than 18 years' time, this world is going to look very different because of the demographic changes that are going to occur, especially in my part of the world, in Asia, where probably the 5 or 6 fastest aging countries, including China. And it's going to be a very different world in less than 18 years' time. And well, as Victor mentioned, I'm the chief executive of an academic health system. Changing a health system to meet the challenges as well as the opportunities of this tremendous demographic shift requires changes in infrastructure, changes in training, changes in the whole workforce profile, changes in legislation, changes in financing, and whether we can accomplish this in less than 18 years, or certainly in Singapore, we have to do this in the next 10 years, is something which is quite daunting. So I really do congratulate the National Academy of Medicine for the foresight in calling this global commission. As Victor mentioned, we've got representatives from 6 continents, and I could not imagine. I'm truly humbled to be a member of such a stellar commission, and I think that we hope that this commission will actually step up and help construct a global roadmap, which would be of value to the communities that we serve.
All right, very good. Thank you, John. Thank you, Linda. Let's now bounce to the second question, which is, what could you share with the audience on what you think is the best possible way this initiative can impact how society perceives and addresses the world's increasing longevity?
You want to go first?
Okay. Well, I'll just continue. Well, thanks, Linda. I would probably say, well, firstly, certainly in my part of the world, reports and certainly reports from the National Academy of Medicine have great impact. It does shape the way we practice, and I dare say that many countries actually look at these reports with great interest. And so, I think that for the Commission to firstly put forward what is the cost of inaction, as well as, very importantly, curating the evidence, and then putting forward both the opportunities as well as the recommendations for interventions, which we've heard from expert panels, starting off with today's workshop, and we've got 2 more workshops looking at health systems as well as how science and technology can make that impact. I think curating this evidence and coming up with a consensus on recommendations would truly be a great step forward, and certainly benefit my part of the world.
So I guess I would add that as many people in this room have pointed out in their own work, we've never had a world of longer lives before. We've actually added a whole new stage to human existence that didn't exist before. And so we could say this is the design opportunity of the 21st century. to design a stage of life and to think about what our societal aspirations are for what that could enable for everybody, and how to make it great for everybody. What a fabulous opportunity. But because we never had it before, this is one of these rare situations which doesn't fit into how we tweak the present to make it slightly better. Because we never had this before, we actually have to imagine a disruptive and different future in order to build something that would be great. And luckily, we are at a moment where we know a lot that we didn't know 30 years ago, even 18 years ago, about what the possibilities could be that are quite disruptive. We know that it is possible to have a health span that approaches life expectancy. We didn't know that 30 years ago. And we also know that only some people are experiencing it, which suggests that the conditions of people's lives might really be important to look at to see how we elevate that opportunity for everybody. So how we create a future vision that is not predicated on the past because we've never had this before is an immensely exciting and important challenge, which I think we have the commission to rise to.
Yeah, absolutely. Okay. Thank you, Linda and John. Excellent, excellent. And, really, if you think about the connection between their remarks, and John, I appreciated your comment about, we really don't want to bear the regret of inaction, nor look at this through the rearview mirror. So again, we all, I think, are here and we agree that the call to action is so timely and so important and so critical. And yes, a little scary. I think some of the best things in life are opportunities that are blended with both a little bit of fear along with some excitement. And certainly as we all venture forward, it's an exciting time to kind of create that roadmap. So again, thank you, Dr. Dzau, for your leadership. And if we owe both Linda and John a round of applause for their input. And we could talk for much longer, but we shall not. I think now at this point, both Victor and Deb are going to join us. Is that right? Is that next on the schedule? Okay, very good.
Well, Debra and I have a pleasant duty to not only thank all of you for being here, but to ask you to join us for a drink. But before we do that, we have a few gifts to be given out to our three participants, and of course, Deb, to you as well. May I open yours?
Yeah.
I thought I'd show you what she's going to get.
Victor and I have gotten very close. Yeah.
So it's a plaque that celebrates this event. It's called National Academy of Medicine Health and Longevity Global Grand Challenge. Thank you.
Victor.
Thank you. And Lance, to you.
Thank you.
Thank you very much.
Appreciate it. Thank you.
It'll be on your shelf.
That's right.
And Linda, you have so many different awards and stuff. Where are you going to put this?
In the front.
Okay, good. And John, thank you again. So, round of applause for everyone.